the meeting usually do signing, and some things might have to wait for Jennifer, who has the flu. So that's why she wasn't here.
Yes.
Okay, so let's get going. Just take this at the top. Bottom of the packet, 455-page packet. Is that the record? I'm not sure. Okay, I'd like to call this Board of Health monthly meeting on Wednesday, March 11th to order. Please call the roll.
Daniel Chenoweth.
Present.
Jennifer Locke. Charlene Murray. Here.
Take a motion to approve the agenda. I have a motion. I move and Charlotte second. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed? That carries. Next, I give approval of the minutes of previous meeting for February 11th, 2026. That's a motion.
Second.
A motion second. Any discussion? All those in favor say aye. Aye. Opposed? That carries. Next, we have public participation. I apologize to any member of the public who's waited. Okay, no. So next we have correspondence, clarification for grant contract agreement. Is this one, this document?
No. So
Okay.
that's actually on page, just number 7 in the back. So I
Okay.
think we can skip that.
Okay. You want to skip, so clarification of grant contract
Because
agreement
we're gonna talk about it on the 7th.
I see when we get to 7, got it, all right, cool.
Discussions.
I was like, April 7th, okay. Public comments at Board of Health meetings, is that is this?
Yes,
Okay.
so we wanted to provide this quick summary of, updates about public comment during Board of Health that, any member of the public, including our staff, can come in and provide any comment that they might have that would necessarily don't need to answer to their comment, that you can just take note and say that, we received their comment and thank you, then we can discuss it later.
Okay.
But I think Pat, our HR director, put this together that it might be nice for especially people who are new to the board,
Yeah.
for their knowledge about public comment.
Okay. Yeah, so, I looked this over and I think that it very much is in line with where I stand. And so, anyone can make a public comment, and that's really important, I think, to our process. And for the board to understand that workforce disputes go through a grievance process. And so it's really important that we not make it difficult or say that people can't speak to the board. I think in the past, what I've done is asked questions, which I think is really important for the board to have the right to ask questions, which is different, I think, than taking an action, negotiating terms, et cetera. I don't think the board, when it comes to HR, when it comes to confidential personnel matters, I don't think we should be asking. I've seen both people bring I statements to the board, which I think is then they are choosing not to be confidential. And then I've heard people bring hearsay to the board. And I would just encourage us to be careful around hearsay. Like, I don't think that we should be asking for additional hearsay evidence. We should be asking those individuals to go through the grievance process. Yeah, otherwise I understand this. I also just want to say I've been asked by folks to meet privately about workplace concerns, and I don't do that. I don't think it's a good idea, especially because we have a union. So, and that hasn't happened recently. It was before we had a union.
Yeah.
I have not been asked to meet since a union was formed.
Okay.
But I was aware it was in the middle of union formation, and I was like, I'm uncomfortable having a meeting. You're welcome to come to the meeting. You're welcome to give public participation. It should be in the public. that we have these conversations.
Yeah.
I was contacted by a staff member of the union that was not an employee, and I had a conversation with them where I was like, you can tell me whatever you want. And so they did. And then I didn't really engage in back and forth with them. So, you know, that's how I handled that at the time, just as a FYI.
She just thought that this might be a good information material for you guys.
Yep.
Just to review and
Absolutely. Did you have any questions, Charlene?
I do not.
Okay. We don't have any old business, thank you for that. So I'm gonna move on to new business with a presentation from Metopio Data Platform. I know we had asked for this before, I'm kinda excited about using it. So go ahead and show us how it's used.
So my name is Mohammed Islam. I'm one of the data analysts here, and I'll run you through the Champaign County Health Atlas and the different features it has. Basic agenda for this presentation is going to be what is the Health Atlas, what can it do, how does it work, what makes it useful for us and the general public, and usage metrics so far since we launched. So firstly, the Champaign County Health Atlas is a centralized geospatial data repository. It sounds a little complicated, but basically we're combining a ton of different metrics and data into one platform where we can map and visualize things and do basic level analysis on these things very quickly. As you can see on the slide, it has 100 different metrics across 10 key health topics. It integrates built-in data visualization and basic analytical tools. And it's a living platform. That means it has regular updates, and it's very flexible to keep up with the evolving needs that we have as an agency and as a community. What can it do? Again, really core central thing is that it's very useful for mapping and visualizing community health data. I think prior to this, you'd have to probably work with GIS and go through relatively complicated steps to do basic mapping. This platform allows you to do it at a much more rapid pace. To do quick analyses. You can stratify data by demographics and other factors to pinpoint analysis and inform decision making. You can conduct different types of spatial analysis using point layers and other things to determine clustering and access to services. And you can, what exists of the comparative analysis, you can do county level versus nationwide and versus the state. So now I'm going to actually do a little demonstration. I think firstly, let me show you how easy it is to actually find it. You just type CUPHD Health Atlas. It's the first thing that will show up. This is the home page that most people will land on. You can actually search for topics just directly via the search bar if you look at it when you land there. So you want to look at cigarette smoking, you can look at that. But to go a little more in depth, there's actually a how to use tab. It has different little tutorials and general feature overviews that can be useful when you're first starting out with the platform. The places section will allow you to kind of look at different zip codes, different cities and stuff, but it's not where the main data is stored. That's under topics. You can see the 10 basic topics about health status, disease, substance injury, health behaviors, and a few others. Some of the subtopics, which are the actual metrics, will be duplicated between different categories, but that's because we find that there's some overlap between different general topics. But say you want to look at anything. Let's start off with disability rates. So up here you have a definition of what the actual metric is. It's percent of residents with a disability in Champaign County. You'll also note here, you'll note this for most of the metrics, what the actual measure means, percent versus rate and versus raw counts, because there are certain measures that will show you just the raw number of people with a certain condition or something. And the first thing you'll see is this map. If you click map layers, you have different levels that you can look at. You can look at it at the zip code level. You can switch it to cities and towns. So it will remap based on the different localities here, Urbana, Champaign, Thomasburg, those things. You can look at census tracts. You could also look at the overall county. though this is going to tell you more of like an accurate measure for the overall county. You can also switch topics within the map as you want to. But so here's the stratification section. Let's actually go back to zip codes first. So if you want to stratify by different demographic groups, you can stratify by race and ethnicity. You can stratify by sex. You can stratify by age. It's very customizable based on what you want to do. You can actually time lapse with this based on different metrics have different amounts of data captured, but you can do a time lapse over a few years, and it'll play it automatically. Initially, it'll do a loading thing for each of them, and then if you redo it, you can see in a live view basically of how the numbers are changing year by year. You can use filters also to do like cross-sectional kind of examinations of, say, like you want to look at disability rates relative to like smoking rates or something. So like you can do that, but it's not a very deep level analysis. It's more of a cursory thing. You can add highlighted places. I don't use this feature much, but you can like add things. But this is probably the most useful one out of these. To me, is point layers, which you can so point layers are something we can curate ourselves, and which also Utopia curates for us, and we can create them as needed by the public, which allows us to map basically different points of interest. So, say relative to disability, we want to map, say, hospitals. You can do that directly here. Or say you want to, actually, let me switch to cigarette smoking, because this is the one I looked at before. Cigarette smoking rate.
Dental providers accepting Medicaid.
Yeah.
Just noticing some things that are helpful.
Yeah. There's for the cigarette smoking rate, we actually made a point there specifically for tobacco retailers. Yeah. So here you can see all the tobacco retailers within the county in 2024, and we can customize these layers as needed and update them each year. Past that point, you have the actual map settings. You can change the color. You can change the background. I tend to do that because I think this is the initial white color can be a bit straining in the eyes. The color scheme, you can switch to orange. You can switch to various color schemes, and we have color schemes that are better for individuals with color blindness, so it accounts for that. Past that, you can actually see, so they're implementing, as far as like, you know, the Healthy People 2030 metrics slowly on the back end. We work with a platform called Utopia. They provided us this service, and they're the ones who implement most of this stuff on the back end, and they're working to implement the Healthy People 2030 metrics into the health atlas over time. There's other settings and stuff here that you can look at. For comparative analysis, so basic level comparative analysis, you can look firstly, as I said before, at like the county versus the state versus the country in that particular year. You can also change the exact chart view. You can little line charts to some more like trend data. You can also change what places you're looking at. You can remove lines from there. You can add other counties if they have data available. Again, you can change time periods, stratification, shorten it if you want, look at a tighter window if needed, stratify it based on different populations. You can also, the rank feature allows you to look at ranking by the different geographical locations here, so you can see which zip codes have the highest cigarette smoking rate, or you can also look at like cities. I did this earlier, but like, I'm forgetting how to find it. But you can look at different cities, and you can look at, say, if Thomasboro has a higher cigarette smoking rate than Champaign, or if Urbana has a higher cigarette smoking rate than Champaign. The last thing they have is the actual sources for the data. Every single data set they have, every single metric that's tracked here is very accurately sourced in as the details of where they get their data. Most of the data is from larger national data sets. Some of the data is based on local data sets that are collected by the federal government or data that we ourselves have uploaded. There's also a help and tools section where you can contact us directly and ask about things we can add to the health atlas or data that may not be available on the front end that we might have on the back end that you might want to access. I think that overall is a very somewhat cursory but overall view of the entire platform. So going back to this, what makes it useful overall? As you can see, the main thing that makes it useful is it serves as a quick reference for both the public and CUPHD itself to track a bunch of metrics, to do basic level analysis, to do mapping and everything else that we want to do in one very seamless platform. We can expand it over time also. We're working on implementing things like the chip and other things, combining it into the health atlas. And internally, the health atlas and its backend data also serves as a very useful tool for starting analyses at our level. Like, I know a lot of people who start their analyses by looking at the data that's available there first, getting an idea of what to look for, getting an idea of what sources they can go to, and then going from there. So we also have usage metrics so far. We've had 662 lifetime users since the platform launched, 103 monthly active users, 36 visualizations have been saved, and 11,473 data points have been downloaded. So a decent amount of usage. And the overall lifetime usage, this is a graph since we launched. You can see spikes based on when people are basically told about the existence of the health atlas. Like people start using it more, it will drop off a little bit, but then it comes back up. It's been actually very frequently used in the last, like since September-ish. So like in the last year, more or less, or the last 6 months. That's more or less everything. I did make a slide asking about questions, but if you have any questions or comments, now is your time.
So I really appreciate the presentation. I think that you did a really great job. I just want to expand on the SHIP component that you mentioned on the expansion. I think it's that SHIP stands for Community Health Improvement Plan as part of our community health assessment that we do. So we want to make this a living document on this platform so community members can actually go in and see all the metrics that we're tracking over a period of 5 years and see how impactful our interventions and our program have specifically on those metrics. So I think that's one of the benefits that we really want to expand and make it public facing document where they can go and keep us accountable for what we're doing. But I really appreciate this team, so they do a really great job. If you have any data need, I think that they can really help and provide really detailed analysis.
Awesome. Thank you for your presentation. I had a number of questions and comments because this kind of thing I've been waiting for a long time, but I think I'm going to hold it because of time and make another, send an email and maybe make a time to, because there's data sets around homelessness and around some of the racial equity pieces that I would love to, see how they interface with this as well. But this is great, and I also would like to kind of think about how I know we've been using this for a moment, but I keep hearing people creating their own data sets that have an overlap with this, and I think it would be great to think about outreach, how to go to the different cities and communities and describe what it is that we're doing and how it can be useful, and even showing the public, having a public outreach event where people could know that they could come here. So anyway, I will save that for another time, but I really appreciate the presentation. Do you have any questions or comments? Okay, thank you so much. Really appreciate it. Treasurer's report, Ron?
Yeah, the numbers are as of January 31st, 2026. We're showing cash on hand of $7,652,765. Our total fund balance is just over $7.7 million. representing 42% of the budget expenditures for the year. We ended the seventh fiscal month with a deficit of $822,182, which is an improvement over the previous months. And that's still against a budgeted deficit of $1.5 million, so we're doing pretty good over from the overall budget. Total revenues exceed just over $8.6 million, or about $1 million, which is under the year-to-date budget, mostly due with the contracts and grants being under budget by $810,000, and the fee for services under their year-to-date budget by $210,000. Total expenditures just shy of $9.5 million for the first 7 months, or $1.7 million under the year-to-date budget, dispersed fairly evenly. Personnel was under budget by $473,000, fringe benefits under budget by $257,000, contractual services under budget by $489,000, and patient care under budget by $128,000.
Great, thank you. Any questions or not? If not, I will move to put the treasurer's report on file.
Second.
Motion is second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Approval of payments to the Board of Health appointees. I'm going to move for Treasurer Ron Fields for February 2026 services and Attorney Trotman for legal services from January 16th of this year to February 15th of this year. And that's a motion. If I could get a second.
Second.
Motion is second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have a review of monthly credit card statements. Do you have any questions? I had gotten a chance to look over, I don't have questions. I'll move to put the monthly credit card statements on file. If I could have a second.
Second.
Motion is second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have discussion and approval for increase in environmental food program fees. I just want to name that this one and the discussion item of the contract and lease agreement policy we might go in more depth. And just because of time, we may want, but I want to give you an opportunity to speak. I just wanted to say that I don't think we're in a position to approve the fees today. I shared with Dr. Tunkara some of the questions that I had, but if you would like to, if there's anything you want to share with the board at this time.
No. I
Okay.
think-
Okay.
But I think we discussed earlier, but I can just give a quick summary of what we discussed. I think the idea was to present, because this has been in motion for a couple of years now. So we just want to make sure that we did the cost analysis comparing Champaign County to other county with similar demographic, population size, and their fee schedule. So we did that. We compare it with McLean County, Sangamon County, McLean County, and we actually took the average of those, in Peoria, we took the average of those 4 counties, and then compare our fees to the average and make sure that our fees are below those fees, the average of those fees. And because of the sake of time, we can come back and discuss, and we really want to get your feedback and input about how to move this process forward. But today the idea was just to bring it in, present to you guys, and see potentially if we can approve it before the next fiscal year. But this is the first step. Once we have your input and hopefully your approval at some point. So we'll take it to the county board for their approval as well.
I would just say what I had said to Dr. Tunkara, which is that when we did the placards for environmental health, we had a process that I thought was really successful, which is that we notified everybody, all the owners who had the permits. We let them know what the change, what we were proposing, and allowed them to provide input. There was a survey, so the electronic survey made that a little bit easier than all the emails. So really continuing to direct people to the survey for feedback helped to minimize that back and forth. And that they were aware of when they could give public input, which they did, And then there were, I think, some modest changes that I think their input helped improve the program. They felt heard, we were able to hear them, and then we made a change. Now, that was a little bit of a bigger change than this, because it was like a program, but I feel like the process is one that we should follow in these, especially if we're looking at what looks like at times 50 to 80% increases. I think that the issue that happens with public entities is that they don't increase their fee on a regular schedule, so then they're caught like looking like they're doing a really big expansion of fees. So I think even if we hear from them, hey, we understand, we see the comparables, could you do it over 2 or 3 years? I feel like that's a very reasonable request, and we're not in a cash poor situation, but we should cover our costs better than we are and be comparable with other communities. So I don't have out of the box any big concerns with the fees, it's more like the process. And then I would like to hear from those impacted, and I may have questions at that time. So I would encourage us to go through that process prior to making a vote. I don't think, since you have the list of folks who already received permits, and you can create a survey to keep it streamlined and then have that time for public input, I feel like, and then allow there to be input, discussion, and we may bump it to the next meeting for a vote, but I do think we could get it done, by June or July, if if we go through that process. So that's my only recommendation.
Thank you for your information.
Sure. Any other input on that? Otherwise, I think it's just for a discussion. Okay, so I'm gonna go ahead and move on. No action on that for now. Approval of bids to Main Street fencing for dumpster fencing. It seemed like it was the bid that ranked the highest, so I would move for approval of that. So motion, second, any discussion? All those in favor say aye. Aye. Opposed, that carries. And then I'm gonna take this omnibus, stocks office furniture for maintenance office furniture, and stocks office furniture for South Break Room furniture. Both of those had the scoring points above, and I'm comfortable moving forward with that. So I make a motion. Motion, second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have discussion of the contract and lease agreement policy with clarification of when the administrator is authorized to sign, and should the memorandum of understanding be included in the policy due to inconsistency of labeling. And I'll just say I read over this piece. It makes sense not to use MOUs for financial things, and I'm trying to figure out if the policy that's in our packet is the existing policy or the proposed policy. That's my only question.
Yeah, we can, for the sake of time, we can bring all of those policy that we have, for you to review before you move with any action on this. But I really feel like we need to clarify this for, because there's a lot of legal things that, at least in my mind, need our attention, because anything that's signed that we haven't really go through line by line, that the agency will be legally binding to those. And the current process, I know due to the background, of the agency, the current process was put in place, but I think that strongly that it's probably time to review that and then move forward with one that's consistent, and allow us to review, at least the lawyers to review and make sure that we don't sign anything that will put us in the situations where we'll be over our head.
So what's in the packet on page 80, is that our current policy?
Yes.
And then you are, and I saw the kind of like, what are contracts versus memorandum. I don't see a proposed change to language.
We didn't, because they wanted to discuss.
Yeah. Just wanted to discuss.
We just wanted
Okay.
to discuss this because I'm sure you know the process,
Yeah.
right? The process is, so can you talk about this, because my brain is.
My understanding is that the process is that every contract, Fred used to say, bring to the board, our former attorney, and we've kind of been trying to figure out what needs to come to the board and what doesn't.
The contract, as the lease
memorandum of understanding, I gave you some examples of that, where some of them really are subcontract agreements, they're not really memorandum
Yeah.
of agreement. I think you mentioned partnership agreements.
Yeah, yeah. Can I
There's just
speak
a lot
on-
of different ones, and we don't know, according to the current policy, does that really mean all of them come?
Mhm.
Or he can sign some or not others, or, you know, what can he do?
Yes.
Can I speak on the partnership one for the
Yeah.
Some of them are at least in my mind, because currently partnerships, at least based on my experience, partnership, if we are doing partnership, it's between two agencies. The head of the agency need to sign those partnerships just to make sure, you know, but operational wise, you know, division directors or program director will carry those. But some of the partnership I've seen, like division directors, the name of division directors on partnership. And
But
from-
without the administrator? Okay.
yeah, without the administrator.
Okay.
I just want to make sure, and I'm not saying that as anyone's fault, maybe that's what the process has been, and I could, you know, but I just want to make sure that we clarify all of those because I think it's crucial for agreement to have both head
Yes.
in the agreement and sign so that we all know who's doing what. Because I'm saying all of that because if something happened, if everything goes fine, there's no issue. But if something goes wrong, that's when the issue happened. And if I'm not aware of that, again, you know, I just can be held accountable for those.
Yes.
But I just want to make sure that we review all of those, and I've seen for you know partnerships, MOUs. I think that you know with communication it's getting better with our team here. But I've also seen with grants, and we have one of the examples that we can share. But with the sake of time, I really want us to have more time to discuss this
Yes.
because I think that it's extremely important. And you sent us one from McKinley,
Yes.
right? They edited an agreement, skipped the organization, and sent it directly to the board.
Yes.
And Danielle was very kind to
Yeah,
send it
just-
to us, right, for us to review. But if there's anything that was
Yes.
changed
Yes.
in that agreement that we did not know, we're legally accountable
Yeah.
or legally binding to that if you have signed it.
Yes. Yes.
So I just want to make sure that we make those really clear for our team's sake and for the board because
Yes.
we just don't want anyone to be.
Absolutely.
We
Yeah,
can take
and-
more time on this,
no.
but I feel like it's time to
Okay.
check this process.
Yep. No, I mean, I would say anything financial or legal or grant agreement needs to come to the board. Partnerships should be assigned by the director and the administrator, and I don't see a need for them to come to the board unless it's significant. And LOSs, which is letters of support, are the only thing you may want to consider, like, well, maybe a director to director of another organization, you're saying, yes, I work with you on food security, and I support that you know, Solar Gradia Farms are putting in a grant, so you might want to think about that level. Those are just quick thoughts, and then we can discuss at the next meeting. So no action currently on this, any other board input? Okay, so I'm gonna move on, no action. There is approval of revised job descriptions, Director of Environmental Health, Director of Maternal and Child Health, and Director of Teen and Adult Services. With, I think some markups in terms of, let's see,
what happens?
at least on one of them, and then the statement was that the other ones had similar kind of changes, so I looked them over and I didn't have specific concerns. This is one of the questions that's come up is like how much we review job descriptions and at what level, so I just want to wrap it back into that conversation. Yeah, anyway, I don't have concerns with the changes.
Yeah. And then I just want to explain the process that went through this. So HR, we discussed all of these job descriptions with our internal admin team, And then after that, HR take all of those input into account, implement those changes in the job description, send it to individual division director to review those changes to make sure that it's consistent with what they want. Someone with their background to be able to do those items listed in the job descriptions. And then, we all agree that, that is, the best description of their job. So we implement those changes and, submit it to you guys for approval. So I think that whatever job description you have on the board agenda is a consensus of our division director's concern here. But the plan is to take that to the next step. So after these approval of these 3 job descriptions, the plan is to do it with all of our divisions directors, just to make sure that it's consistent with what they are doing. Right.
Yeah, it makes sense to make sure that they're under the supervision of the administrator, that they are directing, not overseeing, except for negotiation of grants, which is coordination, because I don't think the negotiation should lie only with because there are legal consequences, and to be clear about the accreditation. Those were all things I thought were good additions. Any other discussion?
No.
Okay.
No, I do like the process and the fact that it goes through so many people. You've got a lot of checks and balances to ensure that it's what is needed for the organization. Would you like that?
I'm trying to remember if I had a motion and a second. Do you remember? Not yet. Okay, so I'm going to move approval of all 3 in the omnibus fashion. I'm going to just ask for a second. Motion and second. Any other discussion? All those in favor say aye. Aye. Opposed? That carries. Next, I'm going to take an omnibus approval. This is a motion to approve check request payable to the City of Champaign for 2026 annual membership to the Community Coalition, UNS Solutions, Inc. for budget professional subscription, SK Service Corp. For gate installation, and Cloud Control and Services, Inc., which is 3 invoices for control boards for repairs. That's a motion. I need to ask for a second. I have a motion and a second. Any discussion? I just want to ask who from our organization goes to the Community Coalition meetings, like the one that happened today.
So we have a lot of people that goes through that. We have our I-Plan specialist that is constantly there. We have our division of research and planning, the Community Health Network anchor. She attends regularly. So our DEI, diversity, equity, and inclusion specialist, she attends regularly, and as often as my schedule allows, I also attend.
Okay.
But it's a great place for us to collaborate with, and build partnership with other organizations. But also allow us to share our resources.
Great. And motion and a second. Any additional discussion? Not all those in favor say aye. Aye. Opposed? That carries in omnibus. Next, I move approval of check request and service agreement with Dental Imaging Technologies for a warranty renewal period of June 9th, 2026 to June 8th, 2027. So moved. I have a motion and a second. Any discussion? All those in favor say aye. Aye. Opposed? That carries. Next, we have a ratification of requisition payable to Patterson Dental Supply for equipment. So moved.
Second.
A motion and a second. Any discussion? All those in favor say aye. Aye. Opposed? That carries. Next, we have approval of lease agreement between CUPHD and Vermilion County for office space located in 20 South College Street, Danville, Illinois, for a lease period of April 1st, 2026 to March 31st, 2027. I'm going to do this in omnibus. Approval of contract agreement between CUPHD and Kevin Elliott Counseling Group for East Central Illinois HIV Care Connect Counseling Services for April 1st of this year to March 31st of 2027. Approval of contract between CUPHD and Rafi Pijan DDS LLC for East Central Illinois HIV Care Oral Health Services on the same contract time. approval of contract between CUPHD and Muhammad Dental Care for East Central Illinois HIV Care Oral Health Services from the same contract time. Approval of rental agreement between CUPHD and Daniel J. Mundy and Jacqueline S. Mundy as trustees of the Family Trust of Daniel J. Mundy and Jacqueline S. Mundy for office space located at 2003 South Banker Street, Suite B, Effingham, Illinois, for a lease period of April 1st, 2026 to March 31st, 2027. That is so moved.
Second.
Motion is second. Any discussion? All those in favor say aye. Aye. Opposed? That carries. Next, we have review and selection of bids for actuarial services for the years ending June 30th, 2026 and through June 30th, 2030. So multiple years. And it looks like the proposed is Menard. As when looking them over, that seemed to be the choice. So I would move approval of Menard for the actuarial services in that time frame. A motion and a second. Any discussion? All those in favor say aye. Aye. Opposed? That carries. Next, we have review and selection of bids for audit services for the years that ended June 30th, 2026 to June 30th, 2030. And it looks like the winner, at least in the point system, is Lauterbach and Amen. And I have personal experience working with them. They're great. And I would move approval of, is that correct? That's the selection for finance? Okay. Just want to make sure. Move approval of Lauterbach and Amen.
Second.
A motion and a second. Any discussion?
No.
All those in favor say aye. Aye. Those opposed, that carries. Approval of compliance training policy 431. I move approval. We have a motion and a second. This is new, correct? Or is it updated?
The policy's new. It was just, we've had the training, but we just needed policy form based on an audit.
Okay, yeah, okay. Any other discussion?
No.
So we have a motion and a second. All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of MOU between CUPHD and Solar Brodia Farm for Healthy Resilient Communities Grant. So moved.
Second.
We have a motion and a second. Any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have ratification of lease agreement between CUPHD and the Board of Trustees for the University of Illinois for office space at 201 West Kenyon Road, Champaign, Illinois. I make a motion.
Second.
A motion and a second. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed, that carries. Next, we have pending grants for the administrator to sign. List of grants.
They didn't have
We don't have.
No? Okay. So there's no action on that. Our next monthly meeting will be April 8th at 5 p.m. And we stand adjourned. Thanks so much.